What's up, guardians of health? Ready to transform your health today? Did you know that many times your body gives subtle signals before a stroke occurs? Most people ignore these signs, which can lead to severe and permanent health consequences. But what if I told you that you can identify the early warnings of a stroke and act quickly to prevent major damage? A stroke, also known as a brain attack, is one of the leading causes of death and disability worldwide. It's estimated that every 40 seconds, someone has a stroke. And the scariest part? Many of the initial symptoms are easily mistaken for minor daily discomforts. This causes precious minutes to be wasted before realizing the gravity of the situation. But here's the main point. Early detection of a stroke can save lives and prevent serious after-effects. By recognizing the warning signs early on, you not only increase the chances of recovery, but also drastically reduce the risk of complications. That's why knowing the signs of a stroke is essential for everyone, not just for those with a history of health problems. So, in this article, I'll show you the 9 major warning signs before a stroke happens and how you can recognize and act quickly to protect your health and that of your loved ones. Get ready, because the information you're about to discover today can be a real game changer. Sign 1: sudden weakness on one side of the body. Imagine you're going about your daily activities when all of a sudden you feel an unexplained weakness on one side of your body. This is one of the most common signs that something is not right. This weakness, which usually affects the arm, leg, or both on one side, can come on suddenly, and many people tend to underestimate it, thinking it's just fatigue. This weakness is one of the main signs of a stroke because it indicates there's a problem with blood flow in the brain, preventing nerve signals from being sent properly to the muscles. It's as if, suddenly, one part of your body starts to shut down. It's not just a matter of being tired. It's a warning that the brain is at risk. What to do? If you notice this sudden weakness, even if it disappears within minutes, it's crucial to seek medical help immediately. A stroke is an emergency, and the sooner you act, the better the chances of a full recovery. But this is just the tip of the iceberg. In the next sign, I'll reveal a symptom that can go unnoticed, but can be just as dangerous. Want to know what it is? Sign 2: difficulty speaking or understanding language. Have you ever tried talking to someone and suddenly realized your words were coming out jumbled, or that you couldn't understand what the other person was saying? This kind of difficulty in speaking or understanding is a classic sign that the brain is facing a serious issue. During a stroke, the area of the brain responsible for language can be affected, resulting in slurred speech, difficulty forming sentences, or even the inability to understand what's being said. This condition is known as aphasia, and often the person tries to speak, but cannot find the right words or speaks incoherently. How to recognize it? If someone suddenly can't speak clearly or seems unable to understand you, ask them to repeat simple phrases like, "Today is a beautiful day." If the person has difficulty repeating or understanding, it's a sign of an emergency. The tip is clear. Time is of the essence. If you notice this symptom, even if only for a few seconds, call emergency services immediately. Never underestimate a sudden speech problem. But wait, we're not done yet. In the next sign, I'll show you a behavior that often goes unnoticed, but could be a major indicator of an imminent stroke. Ready to find out? Sign 3: sudden confusion or disorientation. Have you ever felt completely lost for no apparent reason, like your surroundings suddenly changed? Sudden confusion and disorientation are signs that something might be disrupting communication between brain cells. During a stroke, a lack of blood flow in critical areas of the brain can cause a sudden feeling of disorientation, where the person seems unable to recall simple details, like where they are, who's around, or even the date. This confusion can be temporary and range from mild to severe, but it's a serious symptom that shouldn't be ignored. How does this happen? Imagine your brain is like a computer that suddenly loses connection to part of its hard drive. The information is still there, but the system can't access it. The result? Feelings of confusion, disorientation, and even short-term memory loss. What to do? If someone starts showing this type of behavior, even if they return to normal in a few minutes, don't hesitate to seek immediate medical help. This symptom could be one of the first signs of a stroke, and acting quickly is crucial to prevent further damage. But this isn't the only symptom that can be easily underestimated. In the next section, I'll reveal a sign that's often mistaken for fatigue or poor posture, and that can be a dangerous warning of a stroke. Curious to know more? Sign 4. Loss of balance or coordination. Imagine you're walking normally and suddenly, you start stumbling for no reason or feel like you're about to fall. Loss of balance and coordination is an important sign that something is not working properly in your brain. During a stroke, insufficient blood flow to areas that control balance and fine movements can cause a sudden loss of coordination. People experiencing a stroke might appear clumsy, have trouble walking in a straight line, or even fall unexpectedly. This symptom is often mistaken for temporary dizziness or imbalance due to fatigue, but it's an important warning that should not be ignored. To identify it, observe if there are difficulties performing simple tasks, like picking up an object, standing up without support, or walking without excessively swaying side to side. Any sudden loss of coordination or balance is an indicator of a neurological problem and needs to be taken seriously. If you or someone near you experiences this symptom, seek medical attention immediately. Acting quickly can mean the difference between a complete recovery and irreversible damage. And since we're talking about protection and prevention, if you want to deepen your understanding of how to keep your brain healthy and learn practical strategies to take better care of it, check out the link pinned in the comments. You'll discover exclusive tips that can make all the difference in your health. But this is just part of the puzzle. In the next section, I'll talk about a symptom that's often ignored because it feels like just a tingling sensation. Ready to find out what it is? Sign 5. Numbness in the face, arm, or leg. You know that tingling or numbness sensation that suddenly appears, making a part of your body feel switched off. If this happens in your face, arm, or leg, especially on just one side of your body, it's one of the classic signs of a stroke. During a stroke, blood flow to certain regions of the brain is interrupted, affecting the nerve connections that control sensations and movements. This numbness can start as a mild tingling, but quickly evolve into a complete lack of feeling. Many people ignore this symptom, thinking it's just the arm falling asleep due to position or fatigue, but it's a red alert. How to identify it? If you ask the person to smile and notice that one side of their face doesn't move, or if they can't lift both arms simultaneously, it's a clear indication that something is wrong. This symptom usually occurs suddenly and should be taken very seriously. Quick tip: when you notice this sign, do the FAST test, face, arm, speech, time. Ask the person to smile, face, raise their arms, arm, and say a simple sentence, speech. If there's difficulty in any of these areas, it's time to act quickly, time. But this is just one of the symptoms that can go unnoticed. In the next section, I'll talk about a warning sign that might be hiding in your eyes, and that few people associate with a stroke. Ready to learn more? Sign 6. Visual changes. Have you ever had the sensation that your vision suddenly became blurry or foggy, like a mist is blocking part of your view? Or even worse, have you ever experienced a loss of vision in one eye, as if a curtain were being pulled down? Sudden visual changes like blurred vision, double vision, or loss of vision in one or both eyes are signs that something very serious may be happening. During a stroke, the blood flow to the areas of the brain that control vision can be compromised, resulting in symptoms like distorted vision, blind spots, or even temporary blindness. People experiencing this often think it's an eye problem, like eye strain or even a migraine. However, these sudden changes in vision are an important warning sign that the brain is in danger. How to recognize it? If you or someone nearby notices that their vision is suddenly impaired, even if only for a few seconds, don't ignore it. Pay attention if there's difficulty seeing in one of the eyes, or if the field of vision is blocked in specific areas. What to do? If you notice any sudden visual changes, especially if accompanied by other symptoms like headache or loss of balance, it's essential to seek medical help immediately. Every minute counts when dealing with a possible stroke. And speaking of headaches, in the next section, I'll address a symptom that's often confused with a simple migraine, but can be a dangerous warning sign. Curious to know more? Sign 7. Sudden and intense headache. Everyone has experienced a headache at some point, but did you know that a sudden, extremely intense headache, unlike any you've felt before, could be a critical sign of an impending stroke. This type of headache, often described as the worst headache of your life, comes on suddenly and can be accompanied by other symptoms like nausea, vomiting, or even loss of consciousness. What makes it so dangerous? During a hemorrhagic stroke, when a blood vessel in the brain ruptures, the buildup of blood creates extreme pressure, causing a sharp and devastating pain. The pain can be so intense that some people describe it as a thunderclap inside the head. This symptom is often mistaken for migraines, but the fact that it occurs suddenly and reaches a peak of unbearable pain within minutes is a strong indication of a critical brain emergency. What to do? If you or someone near you experiences this type of headache, especially if it's accompanied by blurred vision, confusion, or weakness on one side of the body, seek help immediately. It's a situation that requires emergency care. Don't try to relieve the pain with over-the-counter medications, as this can delay seeking proper treatment. But that's not all. In the next section, I'll discuss a symptom that's more common than you might think, and unfortunately, is often mistaken for a simple choking incident. You'll be surprised by what's coming next. Sign 8. Difficulty swallowing. Choking on liquids or food seems like a common occurrence, right? But if this difficulty swallowing happens suddenly and is accompanied by other symptoms like muscle weakness or loss of balance, it could be a sign that the brain is in trouble. Difficulty swallowing, also known as dysphagia, is one of the most underestimated symptoms of a stroke. During a stroke, control over the muscles responsible for swallowing can be compromised, resulting in difficulty swallowing even saliva. Many people think they're just choking temporarily, but in reality, this sudden difficulty can indicate a bigger neurological issue. This is especially dangerous because food or liquid can enter the airway and cause severe complications, like aspiration pneumonia. How to identify it? If someone starts choking frequently, coughing, or even drooling during meals, pay attention. A quick test is to ask the person to take small sips of water. If they struggle to swallow or start choking repeatedly, this should be taken very seriously. And remember, taking care of your health goes beyond recognizing warning signs. If you want to know how to prevent conditions like this, and even get a complete plan to improve your quality of life, check out the link pinned in the comments. It's a practical guide that can help transform your health and make you even more prepared to avoid future problems. And finally, we've reached the last warning sign. In the next section, I'll talk about a symptom that can be one of the most dangerous of all, because when it occurs, the reaction time is even shorter. Ready to find out what it is? Sign 9. Loss of consciousness or fainting. Imagine suddenly feeling dizzy, losing consciousness, and fainting without warning. This sudden loss of consciousness can be one of the most alarming signs of an impending stroke. When the blood flow to a significant part of the brain is interrupted, it can temporarily stop brain functions, leading to fainting. This type of symptom is particularly dangerous because, unlike other signs that develop gradually, loss of consciousness is sudden and may not give enough time for an appropriate response. Often, people attribute fainting to fatigue, dehydration, or low blood pressure. But when it happens without an apparent cause and is accompanied by other signs like weakness, difficulty speaking, or confusion, it's a clear warning that the brain is facing a critical emergency. How to recognize it? Be alert if someone suddenly faints, and when they regain consciousness, they show signs of confusion, slurred speech, or any weakness on one side of the body. Even if the person seems to recover after the episode, it's essential to seek medical attention immediately. What to do? Loss of consciousness is one of the most severe signs and requires immediate action. Call emergency services, keep the person lying on their side to prevent aspiration, and do not try to move them until help arrives. Every second counts. Now that you're aware of all 9 major warning signs of a stroke, I hope you feel more prepared to recognize and act quickly in emergency situations. Conclusion: now that you're familiar with the 9 major warning signs before a stroke, I want to emphasize the importance of staying alert to these symptoms and acting quickly. Each of these signs, whether it's sudden weakness, speech difficulties, or visual changes, is your body's way of warning you that something is seriously wrong. And remember, time is a crucial factor when it comes to a stroke. Detecting these signs early can mean the difference between a full recovery and permanent damage. So, don't underestimate even the smallest indication that something is out of the ordinary. If you notice any of these symptoms in yourself or someone close to you, don't hesitate to seek immediate help. Calling emergency services and clearly communicating what's happening can save lives. Even more importantly, share this knowledge with your friends and family. Recognizing a stroke is a collective responsibility, and the more people know how to identify the signs, the greater the chance of preventing devastating outcomes. Now, I want to know, which of these signs have you witnessed or were already aware of? Leave a comment and share your experience. And if you found this content helpful, don't forget to like and share it to help more people be prepared.